I think our mortality for patients who are intubated and land up on a ventilator is going to be similar to that overseas, probably going to be in the region of between about survival between about 15 and 25%. So it's a very, very serious and a disease with high mortality. What one must understand, taking those numbers into account, that's the absolute last layer of patients who are so severely ill that they land up on a ventilator. And certainly the international experience and our own experience here in the Western Cape and within Groote Schuur is that we do everything we can to stave off having to put someone on a ventilator. One of the great big breakthroughs in the management of COVID-19 has been the use of high-flow nasal oxygen therapy. And a lot of patients, as their respiratory disease progresses and they're struggling to breathe, we first put them onto special machines which give warm to humidified oxygen at very high flow rates, up to 60 or 70 liters a minute via nasal cannulae. We allow them to do what we call awake pruning, which is where they lie on their side, they lie on their belly, and they move around from time to time. That helps improve the relationship between oxygenation, ventilation, and blood flow through the lungs. And the good news is a lot of patients who go onto HIFNO actually then do very well and don't need to be intubated. We see some vital signs that historically would have terrified us, patients whose oxygen saturations are sometimes in the 60s and 70s, where normal oxygen saturation is somewhere between about 95 and 100. These are people looking as if they're on the summit ridge of Everest, but we hold in there and they actually cope. And the survival of patients going onto high-flow nasal oxygen has been much, much better. We are certainly saving a lot of lives by using that therapy.
This moment of clarity comes from one of thousands of interviews you'll be able to access by downloading the free biznews.com app in the Apple or Google Play app stores.